Hello team, this is Kanitra and I'm coming to you with the short video learning on proper 15 lead EKG placement on a pediatric patient. The first thing we're going to do is we're going to go to the right side of the sternum and we're going to be placing lead V1 in the fourth intercostal space. So if I go ahead and count 1, 2, 3, 4, and I'm just placing my fingers in between the ribs, and I'll place V1. V2 will come straight across and it's going to be on the left side of the sternum in the fourth intercostal space. Then I can go ahead and place that. The next lead I'm going to place is going to be V4, which is the mid-clavicular line in the fifth intercostal space. So I've already marked the mid-clavicular line, so it's here, and it's usually aligned with the nipple line. And this is fourth intercostal, so this would be fifth intercostal space. I'm going to go ahead and place that lead. Then I'm going to place V3 in between V2 and V4. Make sure your leads don't touch. If they are too close together, you can snip them straight down the middle. If you need them to be a little bit smaller, you can cut some off of the top. The next lead that I'm going to place is going to be V6, which is going to be at the mid-axillary line, and it's going to be horizontal to V4. So I'm going to follow this all the way over. I've marked the mid-axillary line, so it's just straight midline underneath the armpit. I'm going to place V6. V5 will go at the anterior axillary line, which is going to be in between V4 and V6, and it's going to be horizontal. These should line up. And then V7 is posterior axillary line, and it should line up as well. Now we're going to move back to the right side of the chest here, and we're going to be placing lead V4R, which is going to be in the fifth intercostal space. So remember, this is fourth intercostal, and it's going to be fifth intercostal at the mid at clavicular line, and we're going to place that here. And then we're going to place VR3 in between V1 and VR4. Make sure they're not touching. We'll go to the right side. I've placed the right arm with the tab facing up towards the heart. We'll move back over to the left side. I placed the left arm, the tab facing up. And we're going to go to the lower extremities here. And we have left leg and right leg facing up towards the heart. And you've properly placed 15 leads.